Hi. So I'm Dr. Terri Clark, and I'm an associate professor and RN to BSN facilitator at Austin Peay State University in Clarksville, Tennessee. I have been in nursing for about 30 years and higher ed for about 20 years. I've worked in public health, community health, and telehealth. And I wrote this wonderful article with my colleagues here. The name of our article is Gut Microbiome and Health. And next I'll let Dr. Butler introduce herself.
Hi there, my name is Kristen Butler, and I too am an associate professor for the School of Nursing at Austin Peay State University. I have been a registered nurse for 20 years, and I have experience in both clinical and non-clinical settings to include women's health, med-surg, home health, clinical education, leadership, and now higher ed. In my current role, I provide instruction for undergraduate nursing students in fundamentals in pharmacology.
Hi, I'm Dr. Debra Rose Wilson. I am a nurse first, and I have a PhD in health psychology with a focus in a field called psychoneuroimmunology. I have a Master of Science in Holistic Nursing, and I have expertise in women's health, chronic disease, basic immunology issues as my PhD in psychoneuroimmunology focuses in on. Psychoneuroimmunology is the science behind holistic nursing and includes the gut microbiome. I have also expertise in epidemiology and breastfeeding trends, and I'm an old labor and delivery nurse. I have quite a few publications, more than a couple hundred, and I do a lot of research with my colleagues here at Austin Peay. I am a clinical hypnotherapist in private practice, and I was the 2017 Holistic Nurse of the Year for the American Holistic Nurses Association.
Research demonstrates that the microbiome and health are connected. We often use the expression gut health when we're talking about the microbiome, and a healthy gut is essential for our overall health and well-being. Imbalanced gut health or dysbiosis has been linked to obesity, cancer, mental health conditions, and diseases of the GI, cardiac, endocrine, musculoskeletal, immune, and neurovascular systems. Nursing care is evolving, and a healthy microbiome is a new objective that should be included in clinical care. Gut health offers a new approach to health promotion, disease prevention, and disease management. Nurses can make a direct impact on client health by educating clients on the importance of gut health and emphasizing why a healthy diet promotes disease prevention and supports disease management. Nurses play an important role as clinicians to educate and to advocate for our clients. Understanding this connection between the microbiome and health can improve client health and the efficacy of treatment plans.
I wanted to talk a little bit about what first drew me into the microbiome. I learned about it 20 years ago when I was just really kind of starting. I was in my PhD program, and it was just kind of starting, and it seemed to be important, but we didn't know a lot yet. And it was only a couple years later when I was taking students to a labor and delivery unit that someone was talking about seeding C-section babies, meaning taking vaginal swabs from the mother and putting it on the baby, on the skin, in the mouth, in the nose, in the eyes, in the ears. And this was all new information to me. And there was just this moment of, what? And so when I really dug into it, I thought at first, how could this possibly be that important that we'd want to do this? And then it became incredibly clear. This is incredibly important. Most of our gut contains our immune system. 80% of our immune system lives in our gut. And these little microbes take in fiber, ferment it, grow some really cool stuff like serotonin. And we don't have those neurotransmitters for dopamine, serotonin, pick one. They're all made in the gut. And without this healthy, balanced microbiome, it affects every single part of our immune system and our mental health and our physical health. So looking back from a holistic perspective, I just thought it was really, really interesting that this was so important. And I did speak to some holistic theorists about this, like how does this fit into holistic nursing theory? And kind of where we're going with that is these microbes are part of us. They're part of, we can't survive without them. It's a symbiotic relationship, but they're part of the us that we need to be taking care of when we're taking care of a whole patient.
Yeah, this article is really interesting. It takes a broad perspective and it just connects the gut microbiome and so many different health issues that we have: cancer, diabetes, cardiovascular disease, mental health issues. So it really covers the whole spectrum of different problems and issues that we can have and connects it to how it relates to the gut microbiome. So I think it really could help any kind of nurse. And then it has some very practical elements to it, and it talks about different foods we can eat and things like that. The main thing is yogurt is the star of this article, and then things like pickles and stuff like that. So it has some really practical elements for all of us, for to teach our patients and for just us as humans. And then the bonus, the last thing I'll add, is it does have some continuing education credits to it. So if someone wants to read it and take a little short post test, they can also get some credit there if they need it.